The Michigan Consumers for Healthcare Coalition is working to address the opportunities that healthcare reform presents and provide a coordinated strategic consumer voice at healthcare policy tables to achieve both immediate and long-term results. Joining me now is Don Hazaert, the Executive Director of the Michigan Consumers for Healthcare. Thank you so much for joining us.
Thank you for having me.
Talking a little bit more in detail about how people can get some help navigating themselves through this somewhat confusing process. What does your organization do in particular to help folks here in Michigan figure out what they need to know maybe before they go to healthcare.gov?
Right. Well, I don't know that everybody needs assistance. Healthcare.gov was designed so that the average American can get themselves enrolled. But many citizens do need assistance. Perhaps they've never had health care insurance before. They don't know what an HMO is or a PPO. They just don't know they need assistance, or perhaps there are some language barriers or physiological barriers. So some people are going to need assistance, others may not. For those who feel they need assistance, there are lots of assisters available out there to help them at no cost. A great resource is to go to enrollmichigan.com, which is our website. We are a statewide navigator agency, and we provide enrollment assistance to consumers at no cost.
So if folks can sit in the comfort of their own home before they go to healthcare.gov, go to enrollmichigan.com and have their questions answered in depth as far as what policies might be best for them, that type of thing?
Absolutely. People have questions, and these questions vary. So an excellent resource is simply to pick up the phone and call a navigator in your area and see if that navigator can answer your questions over the phone. And if after having that conversation, you want that navigator to assist you in getting enrolled, you can also make an appointment to go see that navigator. They're happy to do that. They're happy to assist you in person, and they will take good care of you. And there's lots of resources available to make sure you get enrolled in healthcare coverage.
So your organization, which we should mention, was not even necessary 2, 3, 4 years ago.
Right.
But in response to the implementation of the Affordable Care Act, you were formed back in 2011 so that consumers had a little bit of a voice on what was happening. You actually, in addition to the website, because a lot of folks, as online savvy as most of us are, prefer to be able to pick up the phone and talk to a real person and ask some detailed questions about their particulars. You have certified application counselors. So these are even a whole new segment of jobs out there.
Right.
Where folks will not only talk to you over the phone, but set up an appointment with you if necessary.
Right. As I mentioned, there are a lot of assisters out there, not just navigators. There are also certified application counselors, as you indicated. If someone would like to use a certified application counselor, we have a list of all those available at healthcare at enrollmichigan.com as well. The difference between a navigator and an assister is a navigator receives more training, essentially. So a navigator, for example, is trained to help small businesses. A certified application counselor is not. But the bottom line is they're all there to assist you. No one's going to charge you any fee for their services. They're just there to assist you in getting enrolled in coverage.
And they're giving you an objective viewpoint. There's no party affiliation. There's no sales pitch, if you will, going on.
Well, that's true of navigators. Navigators by law cannot have any conflict of interest, so you don't have to worry about any navigator you call on the phone trying to steer you into a particular commercial product. A CAC, a certified application counselor, they are allowed to have conflicts of interest, but they have to identify those. So if you choose not to go with a navigator and would like to just go with a CAC, perhaps there's a CAC local, and the navigator, you would have to get in your car and drive to see the navigator. Perfectly fine. Just ask that CAC to identify any conflicts of interest up front.
And just folks who have questions about or are having difficulty with the marketplace or going to healthcare.gov, those are primarily the clients or the folks that should be coming to you.
Yeah, absolutely. And again, you don't have to go to healthcare.gov first. You can call a navigator first. There's lots of confusion out there, and a navigator is an excellent resource to address a lot of that confusion because, again, they have no conflicts of interest. For example, a lot of older citizens are a bit confused whether they have to go to healthcare.gov or would they go through the normal enrollment process for Medicare. That's because both enrollment periods are happening at the same time. They don't have to go to healthcare.gov, but I use that as an example. So if you're a little bit confused, feel free to pick up the phone, call a navigator. Navigator will be happy to answer your questions.
So I know you have one-on-one contact daily with these navigators and these application counselors. What are they telling people? What is the information? What are the plans like? And what are the response from consumers here in Michigan?
Well, a navigator's there to give people a sense of what's available to them, give them a sense of the tax credits that are available to them, and then help them enroll if they make that decision to enroll. So at healthcare.gov, we have an average of 43 different plans that are available to the average consumer in Michigan. So there's a lot of consumer choice, and that's really exciting in Michigan. And every plan being sold at healthcare.gov provides excellent coverage. There's 10 essentially qualifying levels of benefit like maternity care, prescription drugs, doctor visits. All these plans have to cover that full range of benefits. And there's lots of transparency and affordability thanks to all these tax credits and subsidies that are available at healthcare.gov. So lots and lots of reasons for every citizen to take a moment and take a look at what's available at healthcare.gov if they need insurance or are looking to make a change.
So certainly in the media there's been a lot of discussion about the difficulty of the website and issues with the website. If someone were to make an appointment with one of your folks to help them actually apply and go online, how are you able to help better navigate or have better success with that website than perhaps if I'm just sitting in my own home by myself trying to do it myself?
Yes, so there were lots of problems with healthcare.gov. Thankfully, most of those have been resolved. So for those individuals who are creating a new account, they're really not experiencing very much in the way of problems. For those folks who created an account for themselves prior to that, they are experiencing some problems still, and a navigator can help them in essentially resetting their account and allowing them to move forward. So again, navigator is there to assist them depending on what their level of assistance is needed. So feel free to pick up that phone.
How much of a response have you gotten? Do you have, a phone that's ringing off the hook all day long? Do you attend and go out into the public and have standing room only events? Or is our questions simply trickling in?
No, our phones are ringing off the hook. Yeah, there's no question about that. There's a tremendous amount of interest in getting enrolled in coverage. The issue has been there has been some technical issues that have prevented some folks from getting enrolled, and we're working with those folks in dealing with those issues. In addition to a navigator helping you in their office, navigators also need to go out into the community. That's part of their job as well, is to go into the community, do public presentations, reach out into the community and do that type of education. And navigators also have to be sensitive to the communities they reach. So if a community has special language needs, that navigator agency needs to be prepared to meet those language needs in that particular community.
You've been doing this for a few months now. What are the biggest questions, or what is the biggest question or concern out there?
Affordability, and I think it's really important that people understand to take the time and go ahead and go through that application process and get that determination letter. A lot of folks see the initial sticker price on a policy and they think that's how much a policy is, and that's not the case. That's just the initial sticker price. But there are also tax credits available to reduce your monthly premium, and there's also subsidies to reduce your out-of-pocket expenses. So anyone under 400% of the federal poverty limit is going to receive some level of assistance at healthcare.gov. And that's quite a bit. That's $94,200 adjusted gross income for a family of four. So first, make sure you understand where you qualify as far as tax credits, and then make sure you understand how those tax credits and subsidies can make purchasing insurance more affordable for you and your family.
All right, thank you so much. Again, the website enrollmichigan.com. Thanks for all the great information, sure. And you've got your work cut out for you in the coming months. Don Hazaert from the Michigan Consumers for Healthcare. Coming up next, we will talk with the Business Outreach Coordinator for Michigan Consumers for Healthcare, Brett Williams. He will join us to talk small businesses and what they need to do to navigate the Affordable Care Act. We'll be right back.